Phlebotomy Certification Mock Exam. Question 1. Before a fasting glucose collection, at the hospital laboratory, Brian is awake and the requisition lists of fasting glucose. Which action best confirms the patient identity before the draw? Option A. Use the room number because it matches the schedule. Option B. Collect the specimen first and verify the chart afterward. Option C. Ask the patient to state 2 identifiers and compare them with the requisition and labels. Option D. Ask a co-worker if the patient looks familiar. The correct answer is option C. Ask the patient to state 2 identifiers and compare them with the requisition and labels. Positive identification requires active confirmation with 2 patient-specific identifiers and comparison with the order and labels. Room numbers can change, visual recognition is unreliable, and verifying after collection increases the risk of a wrong patient specimen. Question 2. In the medical surgical unit, during a weekend collection in Bay 7, the wristband and requisition do not match. What should the phlebotomist do first? Option A. Ask another patient nearby to confirm the identity. Option B. Use the patient statement only and ignore the wristband. Option C. Draw the specimen and write a note on the tube. Option D. Stop the collection and resolve the discrepancy according to facility procedure. The correct answer is option D. Stop the collection and resolve the discrepancy according to facility procedure. Identification discrepancies must be corrected before any specimen is collected. Drawing first, relying on one source, or asking another patient creates an avoidable patient safety and specimen integrity risk. Question 3. For a pediatric patient in bed 18, a requisition for Chloe is missing the provider name and test priority. Which response is most appropriate? Option A. Clarify the incomplete requisition before collecting the specimen. Option B. Choose routine priority because most draws are routine. Option C. Ask the patient which tests are needed. Option D. Collect all possible tubes to save time. The correct answer is option A. Clarify the incomplete requisition before collecting the specimen. A complete order supports proper collection, timing, tube selection, and result routing. Collecting extra tubes, guessing priority, or asking the patient to select tests can lead to incorrect or unauthorized testing. Question 4. While preparing MIA for a CBC is ordered stat for a patient in the long-term care facility. What does the stat priority mean? Option A. The patient must be fasting for the test. Option B. The specimen should be collected and processed immediately. Option C. The draw should be cancelled if the patient is not in bed. Option D. The specimen can wait until the next routine round. The correct answer is option B. The specimen should be collected and processed immediately. Stat indicates urgent collection and handling because clinical decisions may depend on rapid results. It does not mean routine timing, fasting status, or automatic cancellation based on location. Question 5. During a urgent care unit collection, Noah says they ate breakfast before a fasting blood culture. What is the best next step? Option A. Collect the specimen and label it as fasting. Option B. Cancel the order without notifying the appropriate staff. Option C. Follow facility policy by documenting the information and confirming whether collection should proceed. Option D. Tell the patient to deny eating so the specimen can be collected. The correct answer is option C. Follow facility policy by documenting the information and confirming whether collection should proceed. Fasting status can affect results, so the information must be handled according to policy and communicated when required. Falsifying fasting status, ignoring the issue, or canceling without proper notification is unsafe and unprofessional. Question 6. During Tara's follow-up draw, a patient scheduled for a trough drug level is due for the next dose soon. When is the trough specimen usually collected? Option A. Immediately after the medication is swallowed. Option B. Only after the medication has been stopped for 24 hours. Option C. At any convenient time during the day. Option D. Immediately before the next scheduled dose. The correct answer is option D. Immediately before the next scheduled dose. A trough level measures the lowest drug concentration and is usually collected just before the next dose. Drawing after a dose, at a random time, or after stopping therapy can misrepresent the medication level. Question 7. During Victor's routine draw, a peak drug level is ordered after medication administration. Which action supports accurate timing? Option A. Use the ordered collection time and facility protocol for that medication. Option B. Collect it whenever the tourniquet is already applied. Option C. Skip documentation because peak levels are routine. Option D. Collect it before the medication is given. The correct answer is option A. Use the ordered collection time and facility protocol for that medication. Peak timing depends on the medication and must follow the order and facility protocol. Drawing before the dose, collecting randomly, or failing to document timing can make the result clinically misleading. Question 8. At Suite 12 during a fasting round, which tube should be drawn first when collecting several venous specimens including blood cultures? Option A. Green heparin tube. Option B. Blood culture bottles or sterile blood culture tube. Option C. Lavender EDTA tube. Option D. Gray fluoride tube. The correct answer is option B. Blood culture bottles or sterile blood culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. EDTA, fluoride, and heparin tubes contain additives and are collected later in the venous order of draw. Question 9. Before a lipid panel collection, a venipuncture requires blood cultures, a light blue coagulation tube, a serum tube, a green tube, a lavender tube, and a gray tube. Which order is correct? Option A. Light blue, lavender, green, gray, serum, blood culture. Option B. Serum, gray, lavender, blood culture, green, light blue. Option C. Blood culture, light blue, serum, green, lavender, gray. Option D. Lavender, green, gray, serum, light blue, blood culture. The correct answer is option C. Blood culture, light blue, serum, green, lavender, gray. The venous order of draw reduces additive carryover, cultures first, citrate, serum, heparin, EDTA, then glycolytic inhibitor. The other sequences place additive tubes too early or delay sterile blood cultures, which can compromise results. Question 10. In the oncology clinic, why is the order of draw important during venipuncture? Option A. It makes all tubes fill at the same speed. Option B. It prevents every possible hemolyzed specimen. Option C. It eliminates the need to identify the patient. Option D. It helps prevent cross-contamination from tube additives. The correct answer is option D. It helps prevent cross-contamination from tube additives. Order of draw is used to reduce carryover of additives that can alter laboratory results. It does not control fill speed, replace patient identification, or prevent all causes of hemolysis. Question 11. For a school-age patient in Suite 12, a light blue top tube for CBC is underfilled. Why is this a problem? Option A. The blood-to-anticoagulant ratio will be incorrect for coagulation testing. Option B. The specimen will automatically convert to serum. Option C. The glucose level will be falsely preserved. Option D. The tube will become sterile after centrifugation. The correct answer is option A. The blood-to-anticoagulant ratio will be incorrect for coagulation testing. Sodium citrate tubes require a proper fill volume to maintain the correct blood-to-additive ratio for coagulation tests. Centrifugation does not fix the ratio, serum is not produced from an anticoagulated tube, and glucose preservation is associated with gray tubes. Question 12. While preparing Zara for a basic metabolic panel, which additive is commonly found in a light blue top coagulation tube? Option A, sodium fluoride and potassium oxalate. Option B, sodium citrate. Option C, lithium heparin. Option D, EDTA. The correct answer is option B, sodium citrate. Sodium citrate is used for many coagulation studies because it binds calcium in a controlled, reversible way. EDTA is used mainly for hematology, heparin is used for many plasma chemistry tests, and fluoride oxalate is used for glucose-related testing. Question 13. During an oncology clinic collection, which tube is typically selected for a CBC? Option A, gray fluoride oxalate tube. Option B, light blue sodium citrate tube. Option C, lavender top EDTA tube. Option D, red serum tube only. The correct answer is option C, lavender top EDTA tube. EDTA preserves cellular components and is the usual anticoagulant for complete blood count testing. Citrate is used for coagulation, gray tubes help preserve glucose, and a red serum tube does not preserve cells for CBC analysis. Question 14. During Brian's fasting draw, a chemistry test requires plasma and rapid processing. Which tube is commonly appropriate? Option A, sterile blood culture bottle only. Option B, lavender top EDTA tube. Option C, light blue sodium citrate tube. Option D, green top heparin tube. The correct answer is option D, green top heparin tube. Heparin tubes are commonly used when plasma is needed for many chemistry tests. EDTA can interfere with chemistry analytes, citrate is intended for coagulation, and blood culture bottles are for microbiology. Question 15. During Victor's early morning draw, which tube additive helps preserve glucose by slowing glycolysis? Option A, sodium fluoride with potassium oxalate. Option B, clot activator gel only. Option C, EDTA only. Option D, sodium citrate only. The correct answer is option A, sodium fluoride with potassium oxalate. Gray top tubes commonly contain sodium fluoride to inhibit glycolysis and potassium oxalate as an anticoagulant. Citrate supports coagulation testing, EDTA supports hematology, and clot activator tubes are used to obtain serum. Question 16. At room 8 during a routine round, a gold top SST is collected for a chemistry panel. What is the main purpose of the gel separator? Option A, it converts plasma into whole blood. Option B, it forms a barrier between serum and cells after centrifugation. Option C, it sterilizes the specimen during transport. Option D, it prevents the need for patient identification. The correct answer is option B, it forms a barrier between serum and cells after centrifugation. The separator gel helps keep serum separated from cells after centrifugation, supporting specimen stability. It does not replace identification, create whole blood, or sterilize a specimen. Question 17. In the pediatric clinic, after filling a lavender top tube, what should the phlebotomist do? Option A, centrifuge the whole blood immediately for a CBC. Option B, shake the tube vigorously for 10 seconds. Option C, gently invert the tube according to manufacturer instructions. Option D, place the tube upright without mixing. The correct answer is option C, gently invert the tube according to manufacturer instructions. Gentle inversion mixes blood with EDTA and helps prevent clot formation. Vigorous shaking can hemolyze cells, no mixing can allow clotting, and CBC specimens are not centrifuged before hematology analysis. Question 18. For a school-age patient in Bay 3, a lavender tube contains visible clots before CBC testing. What is the likely result? Option A. The clot improves platelet accuracy. Option B. The specimen becomes ideal for coagulation testing. Option C. The tube color no longer matters. Option D. The specimen may be rejected because cell counts can be inaccurate. The correct answer is option D. The specimen may be rejected because cell counts can be inaccurate. Clots trap cells and can make hematology results inaccurate, so recollection may be required. Clotting does not improve platelet counts, does not make the specimen suitable for coagulation, and does not remove tube requirements. Question 19. While preparing Daniel for a type and screen, which venipuncture site is usually preferred for routine adult blood collection? Option A, median cubital vein. Option B, artery in the wrist. Option C, vein on the side with a dialysis fistula. Option D, basilic vein as the first choice. The correct answer is option A. Median cubital vein. The median cubital vein is commonly preferred because it is often well anchored and less close to major nerves and arteries. The basilic vein requires more caution. Arteries are not used for routine venipuncture by phlebotomists, and fistula arms should be avoided. Question 20. While preparing ARI for a blood culture, why is the basilic vein generally used with more caution than the median cubital vein? Option A. It cannot be palpated through the skin. Option B. It lies closer to nerves and the brachial artery. Option C. It contains EDTA from previous draws. Option D. It always contains arterial blood. The correct answer is option B. It lies closer to nerves and the brachial artery. The basilic vein is near structures that increase the risk of nerve or arterial injury if technique is poor. It is still a vein, it may be palpable, and tube additives do not remain in veins from earlier collections. Question 21. During a urgent care unit collection, a patient has a dialysis fistula in the left arm. Which choice is safest for routine venipuncture? Option A, draw directly from the fistula to obtain faster flow. Option B, place the tourniquet tightly over the fistula. Option C, use another acceptable site and follow facility policy. Option D, use the fistula arm because it has larger vessels. The correct answer is option C. Use another acceptable site and follow facility policy. A fistula arm is generally avoided because damage can threaten dialysis access and patient safety. Drawing from it, applying tourniquet pressure over it, or choosing it for convenience is inappropriate without specific authorization. Question 22. After reviewing the basic metabolic panel order, the only visible vein is above an active 4 line. What should the phlebotomist do first? Option A, ignore the 4 because tube additives prevent contamination. Option B, draw directly above the 4 without documentation. Option C, collect from the 4 tubing into all tubes. Option D, look for an acceptable site on the opposite arm or follow facility policy for 4 situations. The correct answer is option D. Look for an acceptable site on the opposite arm or follow facility policy for 4 situations. Specimens should be collected away from active 4 infusions when possible because fluid contamination can alter results. Drawing above the 4, collecting from tubing without authorization, or relying on additives does not protect specimen integrity. Question 23. During Lena's weekend draw, a large bruise is present over the intended venipuncture site. Which action is best? Option A, select a different acceptable site. Option B, draw through the bruise because blood flow is easier. Option C, apply the tourniquet for several minutes to clear the bruise. Option D, massage the bruise firmly before inserting the needle. The correct answer is option A. Select a different acceptable site. Bruised or hematoma areas should be avoided because the specimen may be contaminated with tissue fluid and the patient may be injured further. Drawing through it, massaging it, or prolonged tourniquet use can worsen the problem. Question 24. At collection station 4 during a weekend round, a patient has edema at the proposed puncture site. Why should that site usually be avoided? Option A, edema sterilizes the skin surface. Option B, tissue fluid can contaminate the specimen and make collection unreliable. Option C, edema guarantees a faster tube fill. Option D, edema always makes veins arterial. The correct answer is option B. Tissue fluid can contaminate the specimen and make collection unreliable. Edematous tissue contains excess fluid that can dilute or contaminate the specimen and makes vein assessment harder. It does not change veins into arteries, sterilize skin, or guarantee good blood flow. Question 25. In the morning collection round, what is the usual angle for needle insertion during routine antecubital venipuncture? Option A. Any angle if the tourniquet is tight enough. Option B, parallel to the skin with the bevel down. Option C. About 15 to 30 degrees with the bevel up. Option D. About 90 degrees with the bevel down. The correct answer is option C. About 15 to 30 degrees with the bevel up. A 15 to 30 degree angle with the bevel up supports safe entry into the vein. A steep angle, bevel down insertion, or relying on tourniquet tightness increases the risk of pain, missed veins, or injury. Question 26. In the oncology clinic, how should the vein be anchored before inserting the needle? Option A, hold the needle cap against the vein. Option B, press directly over the cleaned puncture site. Option C, ask the patient to pump the fist repeatedly. Option D, pull the skin taut below the puncture site. The correct answer is option D. Pull the skin taut below the puncture site. Anchoring below the site stabilizes the vein and helps prevent rolling. Touching the cleaned site can contaminate it, using the cap is unsafe, and repeated fist pumping can contribute to hemoconcentration. Question 27. For a pediatric patient in Bay 3, after cleaning a venipuncture site with alcohol, when should the needle be inserted? Option A. After the alcohol has air dried completely. Option B, immediately while the site is still wet. Option C. After wiping the site dry with a used gauze pad. Option D. Only after blowing on the site to speed drying. The correct answer is option A. After the alcohol has air dried completely. Allowing alcohol to air dry supports antisepsis and reduces stinging or hemolysis risk. Inserting through wet alcohol, wiping with used gauze, or blowing on the site can compromise technique. Question 28. While preparing NIA for a glucose test, a phlebotomist palpates the vein again after antisepsis with an unclean finger. What should happen before puncture? Option A. The draw should continue because palpation improves flow. Option B. The site should be cleaned again according to procedure. Option C. The patient should wipe the site with clothing. Option D. The tourniquet should be tightened to remove contamination. The correct answer is option B. The site should be cleaned again according to procedure. Retouching the prepared site can contaminate it, so the site must be recleaned unless sterile technique permits otherwise. Continuing, using clothing, or tightening a tourniquet does not restore aseptic preparation. Question 29. During an oncology clinic collection, for most routine venipunctures, how long should the tourniquet remain on? Option A. At least 5 minutes for accurate chemistry results. Option B. Until all tubes have been labeled at the desk. Option C. No longer than about 1 minute when possible. Option D. As long as the patient can tolerate discomfort. The correct answer is option C. No longer than about 1 minute when possible. Prolonged tourniquet application can cause hemoconcentration and alter some results. Leaving it on for several minutes, delaying removal until desk labeling, or using discomfort as the limit is not appropriate. Question 30. During Zara's midday draw, why should patients avoid repeated fist pumping during venipuncture? Option A. It sterilizes the puncture site. Option B. It prevents all veins from becoming visible. Option C. It replaces the need for tube inversion. Option D. It can contribute to hemoconcentration and affect some analytes. The correct answer is option D. It can contribute to hemoconcentration and affect some analytes. Repeated fist pumping can alter specimen composition, including some chemistry values. It does not sterilize the site, replace mixing, or reliably improve every collection. Question 31. During Malik's afternoon draw, a patient reports sharp, electric pain radiating down the arm during needle insertion. What should the phlebotomist do? Option A. Stop the draw and remove the needle safely. Option B. Ask the patient to ignore it until all tubes are filled. Option C. Rotate the needle several times to redirect it. Option D. Advance the needle deeper to finish faster. The correct answer is option A. Stop the draw and remove the needle safely. Radiating electric pain can indicate nerve contact, so the draw should be stopped to prevent injury. Advancing, ignoring the pain, or rotating the needle can worsen tissue or nerve damage. Question 32. At triage bay during an evening round, a swelling begins to form around the puncture site while the tube is filling. What is the best response? Option A. Continue collecting because swelling means the vein is full. Option B. Release the tourniquet, stop the draw, remove the needle, and apply pressure. Option C. Apply heat and keep drawing through the swelling. Option D. Ask the patient to bend the elbow tightly over the needle. The correct answer is option B. Release the tourniquet, stop the draw, remove the needle, and apply pressure. Swelling suggests a hematoma or infiltration, so the draw should be discontinued and pressure applied. Continuing, applying heat during the draw, or bending the elbow can increase bleeding and bruising. Question 33. Before a type and screen collection, a patient becomes pale and sweaty during collection. Which immediate action is safest? Option A. Give the patient food without checking policy or status. Option B. Tell the patient to stand and walk it off. Option C. Remove the tourniquet and needle, protect the patient from injury, and get help as needed. Option D. Finish all tubes before responding. The correct answer is option C. Remove the tourniquet and needle, protect the patient from injury, and get help as needed. Pale skin and sweating can signal syncope, so patient safety and stopping the procedure come first. Standing, finishing the draw, or giving food without assessment can create additional risk. Question 34. For a geriatric patient in draw chair 2, bright red blood pulses rapidly into the collection device during an attempted venipuncture. What should the phlebotomist suspect? Option A. A clotted EDTA specimen. Option B. Improper tube inversion only. Option C. Normal venous flow from a small vein. Option D. Possible arterial puncture. The correct answer is option D. Possible arterial puncture. Pulsing bright red blood suggests arterial involvement and requires immediate response according to policy. Small vein venous flow is usually darker and non-pulsatile, while clotted EDTA and tube inversion issues occur after collection. Question 35. For a postoperative adult patient in Bay 7, if an accidental arterial puncture is suspected, what should the phlebotomist do? Option A. Stop the draw, remove the needle, apply firm pressure, and notify appropriate personnel. Option B. Apply a loose bandage only and send the patient home. Option C. Collect additional tubes quickly before the artery collapses. Option D. Ignore it if the patient says there is no pain. The correct answer is option A. Stop the draw, remove the needle, apply firm pressure, and notify appropriate personnel. Suspected arterial puncture requires stopping the procedure and applying firm pressure to reduce bleeding risk. Continuing, using only a loose bandage, or ignoring the event can lead to serious complications. Question 36. While preparing Brian for a CBC, a patient has petechiae after tourniquet application. What do petechiae suggest? Option A. The needle gauge is too large in every case. Option B. Small capillaries may be fragile or bleeding under the skin. Option C. The site is fully sterilized. Option D. The patient has no risk of bruising. The correct answer is option B. Small capillaries may be fragile or bleeding under the skin. Petechiae are small pinpoint hemorrhages that can suggest capillary fragility or increased bleeding tendency. They do not indicate sterility, absence of bruising risk, or automatically prove the needle gauge is wrong. Question 37. During an emergency department collection, which step should occur before removing the needle from the vein? Option A. Activate the needle safety device while the needle is still in the vein if not designed for that. Option B. Label the specimen at a separate workstation first. Option C. Release the tourniquet and remove the last tube. Option D. Ask the patient to bend the elbow tightly. The correct answer is option C. Release the tourniquet and remove the last tube. The tourniquet is released and the tube removed before needle withdrawal to reduce bleeding and pressure. Bending the elbow, misusing safety devices, or delaying bedside labeling can create patient care or specimen identification problems. Question 38. After reviewing the ammonia level order, after needle removal, what is the best way to help prevent bruising? Option A. Leave immediately without checking the site. Option B. Have the patient bend the arm tightly upward. Option C. Tell the patient to rub the site vigorously. Option D. Apply direct pressure with clean gauze until bleeding stops. The correct answer is option D. Apply direct pressure with clean gauze until bleeding stops. Direct pressure helps stop bleeding and reduces hematoma formation. Rubbing, bending the arm tightly, or failing to check the site can worsen bruising or miss continued bleeding. Question 39. During Grace's afternoon draw, a patient reports an allergy to adhesive bandages. Which response is best? Option A. Use an appropriate alternative dressing according to policy. Option B. Skip pressure and send the patient away. Option C. Use tape directly over wet blood. Option D. Apply the standard bandage because allergies are rare. The correct answer is option A. Use an appropriate alternative dressing according to policy. Patient allergies should guide selection of bandaging materials while still maintaining hemostasis. Ignoring the allergy, skipping pressure, or taping over active bleeding is unsafe. Question 40. At room 8 during a follow-up round, which device is often helpful for a patient with small, fragile veins? Option A. Broken evacuated tube holder. Option B. Winged infusion set with an appropriate small gauge needle. Option C. Large bore needle chosen only for speed. Option D. Used needle with the cap replaced. The correct answer is option B. Winged infusion set with an appropriate small gauge needle. A winged collection set can offer better control for small or fragile veins when used correctly. Large needles may damage fragile veins, defective equipment must not be used, and used needles should never be reused or recapped. Question 41. In the blood donor center, why might a syringe be selected instead of a standard evacuated tube system for a fragile vein? Option A. It removes the need for a transfer device. Option B. It makes patient identification unnecessary. Option C. It may allow gentler control of suction during collection. Option D. It eliminates the order of draw. The correct answer is option C. It may allow gentler control of suction during collection. A syringe can allow the collector to control suction more gently in selected difficult draws. It does not remove order of draw requirements, should be transferred with a safety transfer device, and never replaces patient identification. Question 42. In the pediatric clinic, when transferring blood from a syringe to evacuated tubes, which method is safest? Option A. Use the same needle to transfer blood after recapping it. Option B. Remove tube stoppers and pour blood into each tube. Option C. Push blood through the needle into the tube stopper. Option D. Use an approved blood transfer device. The correct answer is option D. Use an approved blood transfer device. A transfer device reduces Sharp's risk and helps preserve specimen quality. Pushing through a needle, removing stoppers, or recapping increases exposure risk and can cause hemolysis or contamination. Question 43. For an older adult patient in bed 18, which action most increases the risk of hemolysis? Option A. Shaking tubes vigorously after collection. Option B. Allowing alcohol to air dry. Option C. Gently inverting additive tubes as directed. Option D. Using the correct needle angle. The correct answer is option A. Shaking tubes vigorously after collection. Vigorous shaking can rupture red blood cells and produce hemolysis. Gentle inversion, air drying antiseptic, and proper insertion technique support specimen quality rather than damaging cells. Question 44. While preparing NIA for a therapeutic drug level, a serum potassium result is unexpectedly high, and the specimen is visibly hemolyzed. How can hemolysis affect potassium? Option A. It always lowers potassium to 0. Option B. It can falsely increase potassium by releasing intracellular potassium from red cells. Option C. It proves the patient has no electrolyte problem. Option D. It changes potassium into glucose. The correct answer is option B. It can falsely increase potassium by releasing intracellular potassium from red cells. Red cells contain potassium, so hemolysis can falsely elevate measured potassium. It does not always lower potassium, rule out disease, or transform potassium into another analyte. Question 45. After reviewing the urine drug screen order, which practice helps prevent pre-analytical errors? Option A. Pre-label several tubes before locating patients. Option B. Use only room numbers on specimens. Option C. Label specimens at the patient side immediately after collection. Option D. Carry unlabeled tubes to the desk and label later. The correct answer is option C. Label specimens at the patient side immediately after collection. Bedside labeling connects the specimen to the correct patient at the time of collection. Pre-labeling, delayed labeling, and room number only identification increase wrong patient and mislabeling risk. Question 46. During Fatima's weekend draw, which information is typically required on a properly labeled blood specimen? Option A. Only the room number and bed color. Option B. Only the test abbreviation without patient identity. Option C. Only the phlebotomist first name. Option D. Patient identifiers plus collection date, time, and collector identification as required by policy. The correct answer is option D. Patient identifiers plus collection date, time, and collector identification as required by policy. Labels must support positive specimen identification and traceability through collection details. Room numbers, collector name alone, or test abbreviations without patient identifiers are insufficient. Question 47. During Zara's stat draw, a phlebotomist realizes a tube was labeled with the wrong patient name after leaving the room. What is the safest action? Option A. Follow policy for specimen rejection and recollection if needed. Option B. Scratch out the name and write another one. Option C. Send it to the lab because the tube color is correct. Option D. Use correction fluid on the label. The correct answer is option A. Follow policy for specimen rejection and recollection if needed. Mislabeling is a serious patient safety issue and must be handled by policy, often requiring recollection. Altering labels or sending a known mislabeled specimen can lead to harmful treatment decisions. Question 48. At Bay 3 during an afternoon round, which example is a pre-analytical error? Option A, provider interpreting a completed report. Option B, collecting a coagulation specimen in an underfilled light blue tube. Option C, billing department mailing a statement. Option D, analyzer software calculating a final result. The correct answer is option B. Collecting a coagulation specimen in an underfilled light blue tube. Pre-analytical errors occur before testing, including collection, labeling, handling, and transport problems. Analyzer calculations are analytical, provider interpretation is post-analytical, and billing is not part of specimen collection quality. Question 49. Before a lipid panel collection, a specimen for bilirubin testing must be protected from light. Which handling step is appropriate? Option A, transfer it into a gray top tube after collection. Option B, place the specimen in direct sunlight. Option C, wrap or cover the specimen as required by laboratory protocol. Option D, shake the specimen to remove light exposure. The correct answer is option C. Wrap or cover the specimen as required by laboratory protocol. Light-sensitive specimens should be protected using the method specified by the laboratory. Sunlight, shaking, or transferring to an incorrect tube can compromise specimen integrity. Question 50. In the medical surgical unit, a specimen must be chilled and delivered rapidly to the laboratory. What should guide the phlebotomist? Option A. Whether the patient asks for faster service. Option B, personal preference for all tubes. Option C, the color of the tourniquet. Option D, the test-specific handling instructions in the collection manual. The correct answer is option D, the test-specific handling instructions in the collection manual. Temperature and timing requirements are test-specific and should follow the laboratory collection manual. Patient preference and unrelated equipment color do not determine specimen handling requirements. Question 51. For a school-age patient in room 8, why should tubes be inspected before use? Option A. To check for cracks, contamination, expiration, or vacuum problems. Option B. To decide whether patient identification can be skipped. Option C. To remove the need for order of draw. Option D. To make expired tubes acceptable. The correct answer is option A. To check for cracks, contamination, expiration, or vacuum problems. Equipment inspection helps prevent collection failure and specimen quality problems. It does not replace identification, revive expired supplies, or eliminate the order of draw. Question 52. While preparing Lucas for a glucose test, a tube has passed its expiration date. What should the phlebotomist do? Option A. Use it only for pediatric patients. Option B. Do not use the tube and obtain an acceptable replacement. Option C. Use it if the stopper color looks normal. Option D. Fill it halfway to compensate for expiration. The correct answer is option B. Do not use the tube and obtain an acceptable replacement. Expired tubes may have reduced vacuum or compromised additives, so they should not be used. Appearance, patient age, or partial filling does not make an expired tube acceptable. Question 53. During a blood donor center collection, before a capillary puncture, why is the site often warmed? Option A. To replace the need for patient identification. Option B. To make the lancet reusable. Option C. To increase blood flow to the puncture area. Option D. To sterilize the site without antiseptic. The correct answer is option C. To increase blood flow to the puncture area. Warming can improve capillary blood flow and reduce excessive squeezing. It does not sterilize the site, replace identity checks, or permit reuse of single-use devices. Question 54. After reviewing the hemoglobin and hematocrit order, for an infant heel puncture, which area is generally safest? Option A, center of the heel over the calcaneus. Option B, posterior curvature of the heel. Option C, arch of the foot. Option D, medial or lateral plantar surface of the heel. The correct answer is option D. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel reduces the risk of bone injury when performed correctly. The posterior curvature, center heel, and arch increase the chance of injury or poor specimen collection. Question 55. During Kai's evening draw, why should the first drop of blood from a routine capillary puncture usually be wiped away? Option A. It may contain tissue fluid or debris that can affect the specimen. Option B. It prevents all needle stick injuries. Option C. It is required for blood culture bottles. Option D. It always contains only plasma. The correct answer is option A. It may contain tissue fluid or debris that can affect the specimen. The first drop can be contaminated with tissue fluid or skin debris, so wiping it away supports specimen quality. It is not pure plasma, is not used for blood culture bottles, and does not address sharp safety by itself. Question 56. At room 8 during an evening round, which capillary collection order is commonly used when blood gases are not collected? Option A, serum first, then EDTA, then other additives. Option B, EDTA specimens first, then other additive specimens, then serum specimens. Option C, gray first for every patient, then culture bottles. Option D. Any order because capillary tubes have no additives. The correct answer is option B. EDTA specimens first, then other additive specimens, then serum specimens. Capillary order differs from venous order and commonly places EDTA early to reduce clotting in small volume samples. Serum first collection, universal gray first collection, or ignoring additives can compromise results. Question 57. Before a ammonia level collection, during a finger stick, why should the finger not be squeezed forcefully? Option A. It makes the specimen sterile. Option B. It changes venous blood into arterial blood. Option C. Excessive squeezing can dilute the specimen with tissue fluid and cause hemolysis. Option D. It removes the need to wipe the first drop. The correct answer is option C. Excessive squeezing can dilute the specimen with tissue fluid and cause hemolysis. Milking or squeezing too hard can damage cells and introduce tissue fluid, affecting test accuracy. It does not sterilize blood, transform blood type, or replace correct capillary technique. Question 58. In the oncology clinic, which finger is generally avoided for adult capillary puncture? Option A. A warm finger with good circulation. Option B. The middle finger. Option C. The ring finger. Option D. The thumb or index finger. The correct answer is option D. The thumb or index finger. The thumb and index finger are often avoided because they may be more calloused, sensitive, or frequently used. The middle and ring fingers are commonly preferred when suitable, and warming may improve flow. Question 59. While preparing Zara for a basic metabolic panel, a used lancet remains on the tray after a dermal puncture. What should be done? Option A. Discard it immediately into an approved sharps container. Option B. Hand it to the patient to throw away later. Option C. Save it for the next patient if it looks clean. Option D. Place it in regular trash if the cap is on. The correct answer is option A. Discard it immediately into an approved sharps container. Used sharps must be disposed of promptly in an approved sharps container. Regular trash, reuse, or asking the patient to handle the device creates exposure risk. Question 60. While preparing Tara for a glucose test, which statement best describes standard precautions? Option A. They are optional for routine outpatient draws. Option B. They apply to the care of every patient regardless of known infection status. Option C. They apply only to patients with confirmed HIV. Option D. They replace the need for hand hygiene. The correct answer is option B. They apply to the care of every patient regardless of known infection status. Standard precautions treat blood and certain body fluids as potentially infectious for all patients. Limiting them to known infections, treating them as optional, or skipping hand hygiene defeats their purpose. Question 61. During a pediatric clinic collection, when should hand hygiene be performed during routine phlebotomy? Option A. Only at the start of the workday. Option B. Only when gloves visibly tear. Option C. Before patient contact and after glove removal as part of standard practice. Option D. Only after collecting blood cultures. The correct answer is option C. Before patient contact and after glove removal as part of standard practice. Hand hygiene before patient contact and after glove removal reduces transmission risk. Waiting for visible tears, limiting hygiene to the start of the day, or applying it only to blood cultures is inadequate. Question 62. During Tara's preoperative draw, which personal protective equipment is routinely worn for venipuncture when blood exposure is anticipated? Option A. Sterile surgical gown for every draw. Option B. Reusable cloth gloves from home. Option C. No PPE if the patient looks healthy. Option D. Gloves. The correct answer is option D. Gloves. Gloves are routine PPE for blood collection because contact with blood is reasonably anticipated. A sterile gown is not required for every routine draw, healthy appearance does not eliminate risk, and personal cloth gloves are not appropriate medical PPE. Question 63. During Miriam's afternoon draw, a blood splash risk is expected during specimen handling. Which PPE may be needed in addition to gloves? Option A. Eye or face protection according to exposure risk. Option B. No additional protection because tubes are closed. Option C. A patient wristband. Option D. Open-toed shoes for ventilation. The correct answer is option A. Eye or face protection according to exposure risk. Eye or face protection is used when splashes or sprays may expose mucous membranes. Open-toed shoes are unsafe, wristbands identify patients rather than protect staff, and closed tubes do not remove every splash risk. Question 64. At Bay 7 during an early morning round, after a needle stick injury, what is the immediate first aid response? Option A. Apply a tourniquet above the injury and ignore reporting. Option B. Wash the area with soap and water and report the exposure promptly. Option C. Squeeze the wound aggressively for several minutes. Option D. Keep working until the shift ends. The correct answer is option B. Wash the area with soap and water and report the exposure promptly. A sharps injury requires immediate cleaning, reporting, and follow-up according to exposure control policy. Delaying care, aggressively squeezing, or failing to report can increase health and documentation risks. Question 65. Before a hemoglobin and hematocrit collection, what should happen to a safety needle after venipuncture? Option A. Break the needle off by hand before disposal. Option B. Place it on the tray for later disposal. Option C. Activate the safety feature and discard the device in a sharps container. Option D. Recap the needle with two hands. The correct answer is option C. Activate the safety feature and discard the device in a sharps container. Safety features and immediate sharps disposal reduce needle stick risk. Two-handed recapping, delayed disposal, and manually breaking needles are unsafe practices. Question 66. In the oncology clinic, a sharps container is filled past the marked fill line. What should the phlebotomist do? Option A: push the contents down by hand. Option B: move sharps into a plastic trash bag. Option C: continue using it until the lid will not close. Option D: use an approved container that is not overfilled and follow replacement procedure. The correct answer is option D. Use an approved container that is not overfilled and follow replacement procedure. Overfilled sharps containers increase injury risk and should be replaced according to policy. Pushing sharps down, overusing the container, or transferring sharps to trash is unsafe. Question 67. For a teenage patient in Bay 7, a small blood spill occurs on the collection chair. Which action is appropriate? Option A: wear appropriate PPE and clean with an approved disinfectant according to policy. Option B: wipe it with a dry paper towel only. Option C: cover it with a clean drape and keep collecting. Option D: ask the next patient to avoid the spot. The correct answer is option A. Wear appropriate PPE and clean with an approved disinfectant according to policy. Blood spills require PPE and proper disinfection to reduce exposure and contamination. Dry wiping alone, ignoring the spill, or covering it without cleaning does not meet infection control expectations. Question 68. While preparing CHI for a patient NINR, which practice supports OSHA bloodborne pathogen safety? Option A: recapping every needle after use. Option B: using engineering controls such as safety-engineered sharps devices. Option C: eating at the specimen processing bench. Option D: storing clean tubes inside a sharps container. The correct answer is option B. Using engineering controls such as safety-engineered sharps devices. Safety-engineered devices are engineering controls that help reduce occupational exposure. Recapping, eating in specimen areas, and storing supplies in sharps containers create avoidable hazards. Question 69. After reviewing the glucose test order, a patient with suspected airborne infection requires blood collection. What should guide the phlebotomist? Option A: remove the isolation sign to avoid anxiety. Option B: ask the patient to leave isolation for a hallway draw. Option C: follow the facility transmission-based precaution requirements before entering. Option D: use only standard gloves because airborne signs are optional. The correct answer is option C. Follow the facility transmission-based precaution requirements before entering. Transmission-based precautions add measures based on the route of infection and must be followed. Ignoring isolation, removing signs, or moving the patient unsafely can expose staff and others. Question 70. After reviewing the type and screen order, a patient refuses the ordered venipuncture. What should the phlebotomist do? Option A: draw the specimen quickly before the patient moves. Option B: ask a family member to hold the patient down. Option C: threaten the patient with discharge. Option D: respect the refusal and notify the appropriate healthcare professional according to policy. The correct answer is option D. Respect the refusal and notify the appropriate healthcare professional according to policy. Patients generally have the right to refuse, and the refusal should be communicated and documented according to policy. Forcing, threatening, or restraining without proper authority violates ethical and legal standards. Question 71. During Maya's weekend draw, a conscious adult extends an arm after the procedure is explained. What type of consent is most commonly represented? Option A: implied consent. Option B: telephone consent from billing. Option C: no consent because the form is electronic. Option D: court-ordered consent. The correct answer is option A. Implied consent. An adult who cooperates after explanation usually demonstrates implied consent for routine venipuncture. Court orders, billing conversations, and electronic forms are different issues and do not describe this interaction. Question 72. At room 8 during an early morning round, a confused patient cannot provide reliable consent for a non-emergency draw. What should the phlebotomist do? Option A. Collect extra tubes in case consent is later obtained. Option B. Follow policy for consent through an authorized representative or care team. Option C. Ask another patient in the room to approve. Option D. Proceed because confusion makes consent unnecessary. The correct answer is option B. Follow policy for consent through an authorized representative or care team. When consent is uncertain, policy and authorized decision-making pathways must be followed. Confusion does not eliminate consent requirements, and other patients cannot approve care. Question 73. Before a bilirubin test collection, which behavior best protects patient privacy in a busy waiting area? Option A. Discuss lab results with visitors without permission. Option B. Leave requisitions face up on the counter. Option C. Discuss protected health information only as needed and in an appropriate setting. Option D. Announce diagnoses loudly so patients hear their names. The correct answer is option C. Discuss protected health information only as needed and in an appropriate setting. Privacy rules require limiting disclosure of protected information to appropriate purposes and settings. Loud announcements, exposed paperwork, and unauthorized discussions can violate confidentiality. Question 74. For a postoperative adult patient in triage bay, a patient asks the phlebotomist to explain whether a lab result means cancer. What is the best response? Option A. Give a diagnosis based on the phlebotomist's opinion. Option B. Change the result wording to make it less alarming. Option C. Search the internet with the patient and interpret it. Option D. Refer the patient to the provider for interpretation of results. The correct answer is option D. Refer the patient to the provider for interpretation of results. Interpreting diagnoses is outside the phlebotomist's role and should be handled by the provider. Giving opinions, informal internet interpretation, or altering result wording is inappropriate and unsafe. Question 75. For an anxious adult patient in draw chair 2, a patient with limited English proficiency needs instructions for a time test. What is the best communication approach? Option A. Use an approved interpreter according to facility policy. Option B. Speak louder in English until the patient nods. Option C. Skip instructions and collect any specimen available. Option D. Use a child family member as the default interpreter. The correct answer is option A. Use an approved interpreter according to facility policy. Approved interpreter services help ensure accurate, respectful communication. Speaking louder, relying on a child by default, or skipping instructions can lead to misunderstanding and poor specimen quality. Question 76. While preparing Maya for a CBC, which response shows professional communication with an anxious patient? Option A. Promise the draw will be painless for everyone. Option B. Explain the steps calmly and ask about prior fainting or concerns. Option C. Ignore the patient and focus only on tubes. Option D. Tell the patient fear is childish. The correct answer is option B. Explain the steps calmly and ask about prior fainting or concerns. Calm explanation and assessment of prior reactions help improve safety and trust. Dismissing fear, ignoring concerns, or promising no pain can damage communication and set unrealistic expectations. Question 77. During a morning collection round collection, a child is scheduled for venipuncture and a parent is present. Which approach is most appropriate? Option A. Hide the needle in a way that prevents consent. Option B. Ask the child to sign all legal consent forms alone. Option C. Use age-appropriate explanation and follow policy for guardian involvement. Option D. Use complex medical terminology to impress the parent. The correct answer is option C. Use age-appropriate explanation and follow policy for guardian involvement. Pediatric collection requires developmentally appropriate communication and correct guardian involvement. Complex jargon, deceptive communication, or relying on a child alone for legal consent is inappropriate. Question 78. After reviewing the lipid panel order, a blood culture set is ordered before antibiotics. Which timing is preferred when feasible? Option A. Wait until the antibiotic bag is empty. Option B. Collect only after the fever disappears. Option C. Skip cultures if antibiotics are ordered. Option D. Collect the cultures before antimicrobial therapy begins. The correct answer is option D. Collect the cultures before antimicrobial therapy begins. Blood cultures are ideally collected before antibiotics because therapy can reduce organism recovery. Waiting until after antibiotics, waiting for fever to resolve, or skipping cultures can reduce diagnostic value. Question 79. During Chloe's afternoon draw, for adult blood culture collection, why is adequate volume important? Option A. Blood volume is a major factor in detecting bloodstream infection. Option B. More volume always prevents contamination. Option C. Volume does not matter if the bottle color is correct. Option D. Any drop of blood is enough for all adult cultures. The correct answer is option A. Blood volume is a major factor in detecting bloodstream infection. Adequate blood volume improves the chance of detecting organisms in bloodstream infection. Volume alone does not prevent contamination, bottle color is not enough, and a single drop is inadequate for adult culture protocols. Question 80. At room 214 during a follow-up round, when collecting 2 adult blood culture sets, which practice helps reduce contamination and improve interpretation? Option A. Pour blood from one bottle into another. Option B. Use separate venipuncture sites when required by protocol. Option C. Collect after labeling is completed at the desk. Option D. Draw all bottles from one contaminated site. The correct answer is option B. Use separate venipuncture sites when required by protocol. Separate sites are commonly used to help distinguish true bloodstream infection from contamination and to meet protocol. Using a contaminated site, transferring between bottles, or delaying proper labeling undermines specimen quality. Question 81. Before a lactate level collection, what should be disinfected before inoculating blood culture bottles? Option A. The patient wristband instead of the skin. Option B. Only the outside of the requisition form. Option C. The bottle septum according to policy. Option D. The phlebotomist's pen only. The correct answer is option C. The bottle septum according to policy. Bottle septa are disinfected to reduce contamination when blood is introduced. Cleaning paperwork, wristbands, or pens does not prepare the bottle for specimen collection. Question 82. In the morning collection round, which skin preparation is appropriate for a blood alcohol level collection? Option A. Clean the site with drinking alcohol. Option B. Use isopropyl alcohol and leave it wet. Option C. Skip all skin antisepsis to avoid contamination. Option D. Use a non-alcohol antiseptic according to policy. The correct answer is option D. Use a non-alcohol antiseptic according to policy. Blood alcohol collections generally use a non-alcohol antiseptic to avoid alcohol contamination of the specimen. Using alcohol-based cleaners or skipping antisepsis can compromise either test integrity or infection control. Question 83. For an anxious adult patient in bed 18, a legal blood alcohol specimen requires chain of custody. What is the purpose of chain of custody documentation? Option A. To track specimen handling from collection through testing. Option B. To make a hemolyzed specimen acceptable. Option C. To allow anyone to open the specimen without recording it. Option D. To replace patient identification. The correct answer is option A. To track specimen handling from collection through testing. Chain of custody documents each transfer and helps preserve legal integrity. It does not replace identification, fix specimen quality problems, or permit unrecorded access. Question 84. After reviewing the bilirubin test order, which action supports chain of custody for a drug screen specimen? Option A. Allow the patient to take the specimen home first. Option B. Seal and document the specimen according to protocol. Option C. Change the collection time later if it is inconvenient. Option D. Leave the specimen unattended in a public area. The correct answer is option B. Seal and document the specimen according to protocol. Secure sealing and accurate documentation preserve specimen integrity and traceability. Unattended specimens, patient transport outside protocol, or altered times can invalidate the process. Question 85. During a blood donor center collection, a glucose tolerance test is scheduled. What is important about the baseline specimen? Option A. It must always be collected in a blood culture bottle. Option B. It is optional if the patient feels well. Option C. It is collected before the glucose dose is given. Option D. It is collected only after all timed specimens are complete. The correct answer is option C. It is collected before the glucose dose is given. The baseline specimen provides the starting value before the glucose challenge. Collecting it afterward, treating it as optional, or using a blood culture bottle does not meet glucose tolerance testing requirements. Question 86. After reviewing the hemoglobin and hematocrit order, during a glucose tolerance test, Miriam vomits shortly after drinking the glucose solution. What should the phlebotomist do? Option A. Ignore it and continue all time draws as usual. Option B. Give a second dose without authorization. Option C. Change the order to a CBC. Option D. Notify the appropriate staff and follow facility protocol. The correct answer is option D. Notify the appropriate staff and follow facility protocol. Vomiting can invalidate the test or require specific instructions, so the care team and protocol should guide next steps. Ignoring it, reducing without authorization, or changing the order is outside the phlebotomist's role. Question 87. During Amina's follow-up draw, a point-of-care glucose meter is due for quality control. What should the phlebotomist do? Option A. Run required controls according to manufacturer and facility policy before patient testing. Option B. Use the meter until it gives an error message. Option C. Skip controls because the patient is waiting. Option D. Record control results from memory. The correct answer is option A. Run required controls according to manufacturer and facility policy before patient testing. POC testing requires quality control to verify reliable performance before reporting patient results. Waiting for errors, skipping controls, or fabricating records undermines patient safety and compliance. Question 88. At collection station 4 during a stat round, a point-of-care result is outside the critical range. What is the appropriate response? Option A. Repeat it endlessly without notifying anyone. Option B. Report and document the result according to critical value policy. Option C. Change the result to the nearest normal value. Option D. Hide the result until the patient leaves. The correct answer is option B. Report and document the result according to critical value policy. Critical results require prompt communication and documentation under facility policy. Hiding, altering, or endlessly repeating without notification can delay urgent care. Question 89. Before a CBC collection, what does CLIA wave testing mean in a phlebotomy setting? Option A, testing that needs no quality control ever. Option B, testing that is never documented. Option C, testing that is categorized as simple with low risk when performed correctly under requirements. Option D, testing that can be performed without training. The correct answer is option C. Testing that is categorized as simple with low risk when performed correctly under requirements. CLIA wave tests are considered simple and low risk when performed as directed, but requirements still apply. Quality control, training, and documentation remain important for safe point-of-care testing. Question 90. For an adult patient in triage bay, which step is required before centrifuging specimens? Option A, place one tube alone for faster spinning. Option B, open all tube stoppers during spinning. Option C, spin cracked tubes to test whether they leak. Option D, balance the centrifuge with tubes of similar volume. The correct answer is option D. Balance the centrifuge with tubes of similar volume. Balancing the centrifuge helps prevent equipment damage, tube breakage, and safety hazards. Spinning a single tube, opening tubes, or using cracked tubes is unsafe. Question 91. For an adult patient in room 214, why must many serum specimens clot before centrifugation? Option A, incomplete clotting can leave fibrin and affect separation. Option B, clotting turns serum into EDTA plasma. Option C, clotting sterilizes every specimen. Option D, clotting is only needed for urine specimens. The correct answer is option A. Incomplete clotting can leave fibrin and affect separation. Allowing serum tubes to clot properly helps produce clean serum after centrifugation. Clotting does not create EDTA plasma, sterilize specimens, or apply only to urine. Question 92. While preparing Fatima for a blood culture, what is plasma? Option A. A disinfectant used for venipuncture. Option B. The liquid portion of anticoagulated blood after cells are separated. Option C. The solid clot from a serum tube. Option D. Only red blood cells after centrifugation. The correct answer is option B. The liquid portion of anticoagulated blood after cells are separated. Plasma is the liquid component from blood collected with anticoagulant and separated from cells. A clot, red cells alone, and disinfectant are different concepts. Question 93. After reviewing the fasting glucose order, what is serum? Option A. The buffy coat only. Option B, whole blood mixed with EDTA. Option C. The liquid portion of blood after clotting and centrifugation. Option D. The anticoagulant inside a gray tube. The correct answer is option C. The liquid portion of blood after clotting and centrifugation. Serum is liquid separated from clotted blood and lacks clotting factors consumed in clot formation. EDTA whole blood, gray tube additive, and the buffy coat are not serum. Question 94. During Chi's stat draw, which blood component is mainly responsible for oxygen transport? Option A, plasma water only. Option B, clot activator gel. Option C, platelets. Option D, red blood cells. The correct answer is option D. Red blood cells. Red blood cells contain hemoglobin, which transports oxygen. Platelets support clotting, plasma water carries dissolved substances, and gel is a tube component rather than a blood cell. Question 95. During Maya's routine draw, which blood component is most directly involved in primary hemostasis? Option A, platelets. Option B, sodium fluoride. Option C, tourniquet latex. Option D, serum separator gel. The correct answer is option A. Platelets. Platelets help form the initial plug at a site of vascular injury. Sodium fluoride, latex, and separator gel are collection-related materials rather than blood components responsible for primary hemostasis. Question 96. At Bay 3 during an evening round, what is the function of white blood cells? Option A. They act as clot activator gel. Option B. They help defend the body against infection. Option C. They provide tube vacuum. Option D. They prevent every specimen from hemolyzing. The correct answer is option B. They help defend the body against infection. White blood cells are part of immune defense and inflammatory responses. They do not create tube vacuum, act as gel, or prevent all hemolysis. Question 97. Before a CBC collection, which term means stopping bleeding? Option A, hemolysis. Option B, hemoconcentration. Option C, hemostasis. Option D, hematoma. The correct answer is option C. Hemostasis. Hemostasis is the process that stops bleeding through vessel response, platelet action, and coagulation. Hemolysis is red cell rupture, a hematoma is a blood collection in tissue, and hemoconcentration is concentration of blood components. Question 98. In the urgent care unit, which term describes rupture of red blood cells in a specimen? Option A, hemostasis. Option B, syncope. Option C, phlebitis. Option D, hemolysis. The correct answer is option D. Hemolysis. Hemolysis means red blood cells have ruptured, releasing intracellular contents into the specimen. Hemostasis stops bleeding, syncope is fainting, and phlebitis is vein inflammation. Question 99. While preparing Victor for a bilirubin test, which term describes fainting during or after blood collection? Option A, syncope. Option B, edema. Option C, aliquoting. Option D, petechiae. The correct answer is option A. Syncope. Syncope is fainting and can occur with anxiety, pain, or vasovagal response during phlebotomy. Edema is swelling, petechiae are pinpoint hemorrhages, and aliquoting is transferring a specimen portion. Question 100. While preparing Victor for a CBC, what does hematoma mean in phlebotomy? Option A. The specimen has been centrifuged correctly. Option B, blood has accumulated in the tissue around the puncture site. Option C. The patient has completed informed consent. Option D. The tube additive has expired. The correct answer is option B. Blood has accumulated in the tissue around the puncture site. A hematoma is a localized collection of blood in tissue and may appear as swelling or bruising. It is not a processing step, expiration issue, or consent status.